Whooping cough in the United States is on the rise, and here in Montana, we aren't immune to it. Just this year in Yellowstone County, we've had 11 confirmed cases, and 6 of those were in November. RiverStone Health is warning patients about ways to prevent the spread as we enter into those colder months.
Whooping cough is a respiratory infection that's passed from person to person through coughing, talking, sneezing.
Pertussis or whooping cough. The CDC says it impacts about 10,000 Americans a year, but in 2024, those numbers have significantly grown.
The United States has recorded over 16,000 cases of pertussis in 2024 so far. This is a significant jump compared to the 3,700 cases reported during the same period last year.
Those were numbers Gallatin County Health official Lori Christensen shared with MTN just 3 weeks ago. Now that number has grown to almost 27,000 cases nationwide.
It's 5 times greater than it has been over the last several years. In Montana, we're seeing a very similar trend.
RiverStone Chief Medical Officer Dr. Megan Littlefield says while most adults and older children can get over the illness within a week with antibiotics, infants and elderly populations are at risk.
And what we do know is as you get older, that vaccination protection can wane, but if you get vaccinated every 10 years, it can help to prevent adults and older people from getting it.
Littlefield says the rise could be traced due to declining COVID worries.
During the pandemic, when people were not traveling, wearing masks, there was less risk of exposure. And so the cases went significantly down during that period.
Luckily, there's ways to prevent the spread.
While whooping cough can cause serious illness, it's also important to note that it's generally treatable with antibiotics, and most people make a full recovery.
In Billings, Matt Carmack, MTN News.